So let's take a look at exactly what anxiety is. It's a physiological and emotional response to a threat that the brain perceives. A situation, real or imagined, that causes fear or anxiety triggers our fight or flight response. Our body's sympathetic nervous system is activated by the sudden release of hormones such as adrenaline, and this results in physiological responses such as an increase in heart rate, blood pressure, and breathing rate. The system, however, is not perfect. A frightening experience like seeing a bear on the creeper trail would definitely trigger your fight or flight response, as it should. The sympathetic nervous system is sort of like the gas pedal. It gets you revved up for action. The problem in this is that you may start to associate a situation such as taking a test as a fearful event in your life. And as a result, your anxiety, your fear kicks in, and your fight or flight response is activated. So then you are at this heightened state of arousal, and it becomes very difficult to be able to do the things like concentrate, pay attention, focus that you need to do to take the test and be successful. So what is test anxiety? Test anxiety is a form of performance anxiety, characterized by fear, worry, and tension, and physical distress. Some nervousness can be motivating, and I know you've probably felt that before. If you have no worry or no concern about a test, you may not study at all, and then you may go in to take a test and not do as well because you didn't study or prepare at all. So a little bit of nervousness, a little bit of stress can actually propel us into action so that we perform at a higher level. The problem occurs, as I mentioned earlier, is when this becomes excessive nervousness or stress. This can impact testing. Test anxiety can become debilitating if it is not dealt with properly. This graphic is of the Yerkes-Dodson law, which states that a moderate level of stress goes a long way. It's manageable, motivational, and performance enhancing. Your heart beats a little faster, you feel a sense of clarity and alertness, and your brain and body are fired up to an extent to propel you to do what you need to do to perform well. The problem comes in when your body goes into a state of high arousal, and you'll notice the peak on the curve. A moderate level of arousal equals optimal performance. That gives you just that enough of a boost to do what you need to do, to reach that moment of clarity and focus to do well. When your state of arousal moves all the way over to the high state, you're going to notice that your performance starts going down. The reason for this is that fight or flight response has been triggered, and you continue to ramp that up. Your heart beats faster, but it's unsettling. It becomes distracting, even nerve-wracking. You've lost focus. You're not working towards your fullest potential. You are no longer able to pay attention, and you start to panic. And this is when we see the detrimental effects of test anxiety. So now that we've identified what test anxiety is, what are some of the causes of test anxiety? One of the main causes, fear of failure, the pressure to perform. While some pressure, as we mentioned earlier, motivates us to do the things we need to do, such as study, prepare, too much pressure can immobilize us. Tying self-worth to the outcome of the test. Students that tend to be perfectionists often are more susceptible to test anxiety because they tie their sense of self to how they do in a class. Lack of preparation, poor study habits, cramming right before a test, poor test history. Having past negative testing experiences can lead to a negative mindset and influence the performance on future tests, which can create a vicious cycle of test anxiety. What are some signs or effects of test anxiety? Freezing or going blank during tests. That's something I hear from students over and over again, that they've studied, they've prepared well, they feel good going into the exam, but when they get there, they open the test up and get to that first question, they freeze or they go blank. That is a major symptom of test anxiety. Worrying that you might forget the material while studying, feeling like you've never done enough to prepare, that feeling of dread or fear or failure during tests or exams or before tests or exams, difficulty concentrating or focusing while studying for upcoming tests, particularly if the study sessions have not been broken up over a period of time and there's more cramming sessions going on. A lack of confidence, physical symptoms before a test, sweating, feeling dizzy, gastrointestinal problems, heart palpitations, those kinds of things. Performing well in class or on homework, but not doing well on tests. That's another symptom of test anxiety. So what does test anxiety feel like to us? Three different ways that test anxiety manifests in us: physical, emotional, and behavioral or cognitive symptoms. Physically, we may feel test anxiety by having headaches, feeling nauseous, sweating, heart palpitations, shortness of breath, lightheadedness, feeling faint. Emotionally, feeling fearful, stress, feeling helpless, feeling dread, disappointment, inadequate, racing thoughts, mind going blank. Behaviorally or cognitively, difficulty concentrating. Negative thinking is a major issue with test anxiety. So one thing we're going to talk about is how to break that negative thinking. Comparing yourself to others and procrastinating. Sometimes if we dread something so much, we actually put it off much longer than we should, which just increases the test anxiety. So now that you know what test anxiety is, what it feels like, what it looks like, how do you control your test anxiety? Obviously, one of the first things to implement is an effective study plan. Effective study habits will help you feel more relaxed. Studying in chunks over time is much more effective, obviously, than cramming. Studying in the same place can both increase material recall and recognition. Studies have shown that planning out your study time, and I know that many nursing students have multiple responsibilities, work, family, so planning out that study time. When can you study? I work with students often in developing study habits and study plans, and we get out a calendar. When can you work in an hour? When can you work in 2 hours? If you can have this time planned out, it will also help alleviate some stress. Establish a pre-test routine. What works for you? Is exercising before the test, is that effective for you? For some, that may not be. That may get you too hyped up, your adrenaline pumping too much. But for others, exercising a few hours before may be effective. Using breathing techniques, and we're going to talk some about those breathing techniques. Listening to music, whatever works for you. Think about when you've done really well on tests and you felt really good about that, and then think about the circumstances that surrounded that and try to replicate those. Have a discussion with your instructors. If you are having problems with test anxiety, if you're having problems with understanding the material, if you are confused about what's going to be on the test, get those clarifications from your instructors. Talk to your instructors about what you're not understanding. Just having some of those things cleared up can help alleviate some of that test anxiety going into the test. Chronic stress has been shown to result in increased test anxiety. So if you are under chronic stress, you are more likely to experience test anxiety. So what are some things you can do? prior to the test, or implement overall in your life to help control your stress and therefore decrease your test anxiety. Optimize your nutrition. Stay hydrated with water. Avoid sugary drinks, which cause peaks and drops in blood sugar. Avoid caffeinated drinks. I know we all like some caffeine to get us going, but too much caffeine can cause that sort of jittery feeling that mimics anxiety. So what that can lead to is more test anxiety, because you start feeling jittery, you start worrying about that, the heart palpitations come, and then you're into full-blown stress mode. Eating a balanced meal the day of the test, making sure that you're eating enough protein, that you're not carb loading so much that you're going to experience that crash. Getting some exercise. Regular exercise has been shown time and time again to decrease overall stress. Helps keep tension in check. So exercising on exam day can help release stress, but there again, that's individual. If you feel like that you get too much adrenaline in your system flowing, and that can lead to some tension, more tension, that can lead to some more jittery kinds of feelings later on, then you may want to space out that exercise. So it just kind of depends on how you react to that. Sleep is absolutely essential and directly related to academic performance. Inadequate sleep causes all kinds of issues with our heart rate, our blood pressure, our blood sugar, levels of stress. So be sure, I know it's hard, that you are getting adequate sleep, and particularly the night before the test. So a proven technique in dealing with test anxiety, decrease in test anxiety, includes the cognitive behavioral methods in psychology. And one way, one particular technique that we're just going to talk about is called cognitive restructuring. And basically it involves restructuring your thinking from a negative cycle of thinking to a positive cycle of thinking. When you start having these negative thoughts, you start to feel anxiety. Your adrenaline starts flowing again, and then that fight or flight response is triggered, and then you go into that cycle, and all of those physical things start happening, which just increases the anxiety that you're already feeling. So how can you challenge these? Well, first is to challenge the cognitive distortions. And what are cognitive distortions? They're the rational thoughts that tend to be negative in nature. They lack evidence, but they can still result in that anxiety or those stressful feelings. So just some quick ways to challenge this is to make a habit of using positive self-talk. Doing things like posting positive statements on your mirror, in your car. Just don't read the positive statements when you're driving, obviously. On your nightstand, on your laptop, when you open your laptop. Those kinds of things can help you when you get into a cycle of negative thinking to stop that negative cycle and to turn that into some positive thinking. And it will take a while to do this, but eventually your brain will start to think in more positive terms the more that you do this. Linking these statements, these positive statements, to physical cues. Anything that you associate with the testing environment, your backpack, sitting down at a desk, using your laptop, opening your laptop. You go into Canvas, you may have a test to take or some homework to do. Putting those positive statements on those actual physical items and saying those positive statements when you come into contact with those physical cues, such as your laptop, can help over time turn that into a positive. So when you opened your laptop, maybe you started thinking about going into Canvas. Maybe you started thinking about a test, and then that triggered the fight or flight response, the anxiety increased, you started having the sweaty palms, and the faster breathing, and heart palpitations, and all those things. Using these positive statements over and over again, in conjunction with these physical cues, can turn that around so that when you open the laptop, you start to think positive thoughts. I can do this. I can do this. I'm ready for this. I have studied for this. I'm prepared. I'm smart. I can do this. I got into the nursing program. I have done well. I can do this. Those kinds of things. Our brain can play a lot of tricks on us. So we sort of have to get ahead of the game a little bit. So when you start going down that negative route of thinking, you have to be cognizant of that, stop that, reverse that, and use positive statements to fill that gap. Using positive talk during a test. There again, it's the same thing. You're challenging that negative thinking. You're increasing your self-confidence. You're keeping that fight or flight response at bay. And we're going to talk about some relaxation techniques in a few minutes to use in conjunction with that. This next slide includes two exercises to use to help start the cognitive restructuring process. And obviously, these are techniques that you would not have time to do when you're actually in a testing situation. But these are things that you can do, exercises you can go through to just help prime your thinking for more positive kinds of thoughts. Decatastrophizing, there again, you're challenging these irrational thoughts. When we catastrophize a situation, we tend to think of the problem as more exaggerated than it may be, and we may think about the absolute worst possible outcome. So on this sheet, you're simply challenging some of these thoughts. What exactly are you worried about? Are you worried about, maybe you're worried about this upcoming test. So how likely is it that your worry will come true? What are some examples of past experiences or other evidence to support your answer? So maybe your worry is that you're going to fail this test. Okay, you're in the nursing program. So think back about some prior testing experiences that you've had, and experiences, obviously you've done well if you've gotten into the nursing program. So what's some evidence that helps support this thought? If you're worried about failing this test, why are you worried about failing this test? How likely is this to happen or actually come true? What's some evidence against this happening? Base that on some past experiences. If your worry does come true, what's the worst that could happen? If you failed this one test, what is the absolute worst that can happen? I ask students that all the time in my class. I'll have students that will come in and be extremely upset and worried about a test. And that's something I use a lot. What is the absolute worst that can happen? Well, okay, if I failed this test, are you going to no longer be able to proceed in the class? Okay. Okay, if you're not able to proceed in the class, what are the other options? What is the very worst thing that could happen? And when you really start drilling it down to the absolute worst thing that can happen, you usually find that there's some options there, and there's some things that you can do to make sure that doesn't happen. If your worry does come true, what's most likely to happen? So you're worried about failing this test. If you did fail the test, if it did come true, what's most likely to happen? Well, it may be more likely that it's going to pull your average down in that class somewhat, but you may have another test coming up that you can make that up on. So then you start going into setting goals for that next test. Well, what are the things that I need to do to improve my score on that next test. Socratic questioning. These thoughts are like running dialogue in your brain. They come and go, they come and go. And this is just an exercise to give you a few moments to think about, think about your thoughts, question your thoughts. So what thought is to be questioned? That you are not good enough, that you cannot pass, those kinds of things. What is the evidence for this thought? What's the evidence against it? Am I basing the thought on facts or feelings? Is the thought black and white? And you're often going to find, no, it's not black and white. It's more complicated than that. There may be other things in the class that you can do to pull your grade up. There may be going to talk to your teacher, going to, get some tutoring, going to ATI or Nurse Logic and working on some concepts. There's lots of different things, but you have to stop that negative thinking in its tracks to be able to move beyond that. So when you're actually in the testing situation, it's a good idea to have some positive thoughts in your mind. You may even want to write these down that you can pull from, recite these over and over, that you can pull from when you're in the testing situation to stop that negative cycle of thinking. Things like, I'll start with something I know. Maybe you get to the first question and you're unsure about the first question. So rather than starting that, oh my gosh, I'm not going to do well, what am I going to do? I'm going to fail this test. Rewind that and think about, I'll start with something I know. I'm going to go down a couple questions and look for something I know. I know this material. It's just one test. Even if I feel shaky, I can still do my best. I know why I'm feeling shaky and anxious. It's just adrenaline. It's the adrenaline pumping through my body. I recognize that. I understand that. I'm going to have to deal with that. I'm just anxious, but I can manage. Those kinds of things, I'll do the best I can. I can figure it out one step at a time. Just focus on the here and now. So there's lots of different positive thoughts, but it has to become a habit. It has to become ingrained in you to go to positive thoughts as opposed to going to negative thoughts. And we've all done that. I've done that too. And it's really just a matter of working on restructuring those thoughts. So what are some other techniques to control test anxiety? Learning relaxation techniques. Relaxation techniques coupled with cognitive restructuring techniques have been shown over and over again in research to be effective in reducing test anxiety. So 3 of these that we're going to talk about: deep breathing, mindful breathing, and cognitive reappraisal, cognitive restructuring that we just talked about, yielded a large effect size in reducing test anxiety for undergraduate students. Also, mindfulness breathing practice showed increased positive automatic thoughts over time. Positive imagery. Findings in research revealed that 30-minute guided imagery performed once daily for 1 week significantly reduced test anxiety in nursing students. Progressive muscle relaxation. Research also showed that this was can be one of the strongest and most powerful treatments for psychosomatic complications, including anxiety. Other research also showed that progressive muscle relaxation can be very effective with controlling test anxiety, particularly in nursing students. So what we're going to do now is give you some practice in mindful breathing, in positive imagery, and progressive muscle relaxation. Karen Kilgore, who also teaches some exercise classes at the Coombs Center and here at the college, yoga and other classes. She is going to come on the presentation, and she's going to lead you in these relaxation techniques. So another thought before we get started on practicing these techniques, the parasympathetic nervous system is what controls our fight or flight response. Deep breathing triggers our parasympathetic nervous system and neutralizes the stress and elicits a calming feeling.
Thank you for joining me for progressive muscle relaxation. Progressive muscle relaxation is an exercise that reduces stress and anxiety in your body by having you slowly tense and then relax each muscle. This exercise can provide an immediate feeling of relaxation, but it's best to practice frequently. With experience, you'll become more aware of when you're experiencing tension, and you will have the skills to help you relax. During this exercise, each muscle should be tense, but not to the point of strain. Pay special attention to the feeling of releasing tension in each muscle and the resulting feeling of relaxation. Let's begin. Sit back or lie down in a comfortable position and shut your eyes if you're comfortable doing so. Begin by taking a deep breath. Inhale through the nose and exhale through the mouth. Notice the feeling of the air filling your lungs and hold your breath for a few seconds. Release the breath slowly and let the tension leave your body. Take in another deep breath and hold it. Again, slowly release the air. Even slower now, take another breath. Fill your lungs and hold the air. Slowly release the breath and imagine the feeling of tension leaving your body. Now, move your attention to your feet. Begin to tense your feet by curling your toes. And hold on to the tension and notice what it feels like. Release the tension in your feet. Notice the new feeling of relaxation. Next, begin to focus on your lower leg. Tense the muscles in your calves. Hold them tightly and pay attention to the feeling of tension. Release the tension from your lower legs and notice the feeling of relaxation. Remember to take deep breaths, breathing in through your nose and exhaling out through your mouth. Next, tense the muscles of your upper leg and pelvis. You can do this by squeezing your thighs together. Make sure you feel tenseness without going to the point of strain. Release and feel the tension leave your muscles. Begin to tense your stomach and chest. You can do this by sucking in your stomach and then squeeze and hold the tension. A little bit longer and release. Allow your body to go limp and let yourself notice the feeling of relaxation. Again, continue taking deep breaths. Breathe in slowly, noticing the air fill your lungs and hold it. Release the air slowly. Next, tense the muscles in your back. Shrug your shoulders up toward your ears and hold it tightly. Tense them without straining and keep holding. Release the tension from your back and lower your shoulders. Feel the tension leave your body and feel the new feeling of relaxation. Notice how different your body feels when you allow it to relax. Tense your arms all the way from your hands to your shoulders. Make a fist and squeeze all the way up your arm and hold it. Release the tension from your arms and shoulders. Notice the feeling of relaxation in your fingers and hands, arms and shoulders. Notice how your arms feel limp and at ease. Now move up to your neck and your head. Tense your face and your neck. You can purse your lips together tightly and squeeze your eyes shut. Release the tension. And again, notice the feeling of relaxation. Finally, tense your entire body. Tense your feet, your legs, stomach, chest, arms and neck. Tense them a little harder without straining and hold that tension. Now release. Allow your whole body to go limp. Pay attention to the feeling of relaxation and how different it is from the feeling of tension. Begin to wake up your body by slowly moving your muscles. Adjust your arms and legs. Stretch your muscles and open your eyes when you're ready. And continue to feel the relaxation.
This exercise is designed to help reduce stress by using progressive muscle relaxation along with guided imagery. First, I want you to find a comfortable sitting position, or you can lie down. Make sure your arms and legs are not crossed so the blood flow is not impaired. For this exercise, I'm taking you on a walk at the beach, but you can substitute another place, such as the woods or someplace you really enjoy when you do this on your own. Now that you're comfortable, I'd like you to close your eyes. I want you to take a deep belly breath by breathing in through your nose and exhale through your mouth. I want you to feel your diaphragm rise and release on the next breath. So inhale through your nose and exhale through your mouth. Good. One more time. Nice deep breath in and exhale out. Good. Now it's a beautiful day. You're going to go to the beach where it's the perfect temperature. It's a sunny day. Puffy clouds are all around. The sand is warm, and you have the whole day to enjoy. So I want you to just think about leaving all the stress and tension, clear your mind. You're just going to concentrate on the beautiful day and the time that you have. And so, as you begin your walk along the beach, you're going to notice the warm breeze gently blowing. You're going to feel the warmth of the sun on your skin. You're going to feel the warm sand under your feet. And you feel this relaxation already starting to wash over your body as you watch the waves gently roll in and out. And as you walk along the edge of the shore, you feel the cool sand beneath your feet. As you walk out a little bit farther, you feel the water slosh against your ankles and the warmth from the water and the sand. You feel the warmth of the sun as you slowly walk along the beach. And there's a gentle breeze to keep you cool and comfortable. And you notice the seagulls as they float along on the gentle breeze. And you're just slowly walking and taking things in and enjoying the feeling of just having the day. And as you slowly walk along the beach, you just continue to breathe slowly in and then exhale out. And then you come to a place where you're going to sit in a nice little grassy area just up from the beach. And you sit down and you feel the warmth of the sun and the warm breeze, but you're very comfortable. And while you're sitting there, you're gonna slowly feel that you're tense your feet and then release. And then from there you're gonna tense your leg muscles gently and then release those as you feel your legs beginning to feet relax. And you take a nice deep breath in again and inhale. And then exhale. And next you're going to notice the tension as it is leaving through your abdominal area. You gently tense those muscles through your abdominal area and your back. And then you release those. Just feeling the warmth of the sun. And just feel the tension melting away. Melting up through your chest. You feel it release through your shoulders. And down through your arms. All the way down into your fingertips. And feel this gentle breeze across your body as you feel so much more relaxed. And you continue to feel the tension leave through your neck and even just flow all the way out through the top of the head and the bottom of the feet. You just feel so relaxed. You're just enjoying the moment, feeling the warmth of the sun, the gentle breeze, the sounds of the waves gently coming in and going out, and even the call of a seagull. And now you feel totally and completely relaxed as you lie there. And in just a moment, I'm going to count back from 3, and you're going to continue to feel the feelings of relaxation. In 3, you notice that your body is feeling relaxed all over, all the way from your feet to the top of your head. And that's going to continue to go with you as you continue your journey along the beach. And in 2, You're more aware of your surroundings as you gently press yourself up into a seated position. And in one, you slowly open your eyes. You take in the beauty around you. The beautiful sand, white sand on the beach. The waves slowly coming in and out. The gentle breeze and the warm sun. And you very slowly then stand. And you continue to walk along the beach and enjoy the day. You're feeling totally relaxed now. And from here, you're going to continue to feel the feeling of relaxation as you go throughout your day.
And finally, hopefully these techniques, cognitive restructuring, coupled with adequate sleep, optimizing your nutrition, relaxation techniques, will result in a decrease in your test anxiety. If this doesn't happen and you continue to feel anxiety in the testing situation, or even outside of the testing situation, then there are some other avenues to take. I am the coordinator of services for students with disabilities at Virginia Highlands, and I'm also an academic counselor here. So one of my jobs is to put academic accommodations in place for students who have been diagnosed with sometimes a learning disability, sometimes anxiety, a wide range of diagnoses and disabilities. So if you would like to talk to me about this, I would love to give you some information, and I could talk to you about the process in possibly obtaining documentation if anxiety has become an issue that you're not able to control with some of the techniques that we talked about. And here's my email, and I would be happy to explain the process to you and work with you on looking at if academic accommodations are something that you could qualify for and might be helpful. Also, seeking assistance from your healthcare provider. You can talk to your primary care physician about your concerns related to anxiety and depression. We also have an agreement here at Virginia Highlands with Highlands Community Services. This agreement allows us to make a referral to Highlands Community Services, and Virginia Highlands pays for the initial assessment. So if you would like to talk about this and you feel like you could benefit from counseling, seeing someone else, which can be very helpful. Talk therapy can be extremely helpful in managing anxiety overall. Feel free to contact me or contact your nursing professor and explain to that person what's going on, and they can point you in the right direction. If you felt like going to Highlands Community Services would be helpful, and we arrange that referral after we pay for the first visit, they have a very reasonable sliding fee scale, and they also accept insurance. So please reach out to us if you're not able to get your test anxiety or anxiety overall under control, and we'd be happy to talk to you and sort of see what those next steps might be. Thank you very much for listening. I hope that you find this information helpful, and feel free to reach out to myself, Karen Copenhaven, Karen Kilgore, or any of your nursing professors. Thank you very much.